Hello and welcome to 360 Health. I am Joy Ucheje. On today's edition of the program, we'll be looking at a disease often referred to as the silent killer, viral hepatitis. Now, as the world commemorated World Hepatitis Day in July, Nigerian health experts are raising the alarm over a surge in undiagnosed cases. Viral hepatitis, which includes hepatitis A, B, C, D, and E, remains a major global health concern, silently affecting millions and potentially leading to life-threatening complications if left untreated. Now, the disease can damage the liver for years without presenting any noticeable symptoms. According to medical reports, while all 5 strains of viral hepatitis affect the liver, hepatitis B and C are the most severe, with strong associations with liver cancer and chronic liver disease. In Nigeria, thousands of new hepatitis B and C cases are recorded annually, posing a persistent public health challenge. Many of these cases go undetected due to low levels of awareness, stigma, and inadequate access to testing. According to the World Health Organization, the most critical gap that needs to be closed in order to meet global hepatitis elimination targets by 2030 is low access to testing and treatment. Now, let's get more insight into this situation. Medical doctor and public health enthusiast Dr. Adekbojo Adejoke joins me on the program. Thank you for coming on board. Now, what are the most common types of viral hepatitis affecting Nigerians, and how do their modes of transmission differ? For example, are certain types more prevalent in specific age groups or regions, or do they spread through blood, food, or sexual contacts?
We have 5 types of viral hepatitis. We have hepatitis A, B, C, D, and E. But before I go into that, let me just give an overview of what hepatitis is. So hepatitis is actually the inflammation of the liver. Simply put, it's a disease that affects the liver. Absolutely. So these types of viruses, they have their different routes of mode of transmission, and also, their outcome and everything about them vary a little bit. So hepatitis A and E are fecal-orally transmitted, meaning that they can be gotten through infected or contaminated water and food. While B, C, and D are bloodborne. They can be gotten through contaminated blood or body fluids as well. So that's that about them. But all of them actually affect the liver. And hepatitis, also worthy of note that hepatitis B and C are the ones that are likely to cause chronic illnesses, and especially emphasis on hepatitis B. It's the culprit or the most common cause of chronic liver disease, or chronic or viral hepatitis, so to say. So that's it.
Well, now, in the Nigerian health sector, the problems of limited diagnostic infrastructure, cost of treatment, or lack of public awareness has often been reported as a nuisance. But for this particular disease, hepatitis, what are the major challenges in diagnosing and treating this disease in Nigeria, and how can these challenges be addressed? Can you elaborate on barriers like this?
Okay, well, I don't really think there is any major challenges, like national major challenge now, but of public health importance, the major thing is the health-seeking behavior of people. You know that in this part of the world, we have this habit of not going for health checkup or going to the hospital for checks until we actually fall ill. So as a result of this, most cases of hepatitis go unnoticed. They are picked on as incidental findings, or maybe for some reasons. For instance, maybe a woman that is going to the hospital to register for antenatal care, and because it's one of the routine tests that is being done, so it's possible that we pick hepatitis infection in that person. And maybe for some other people that go for blood transfusion, or they want to do surgical procedures and they need to do serology tests, and instances like that, but we don't usually have people walk into the hospital and say they want to check themselves as much. So it's responsible for the reasons why some people will present late for liver disease. Maybe it's until when they start having symptoms like the yellowness of eye, or some other symptoms like that eventually brings them to the hospital, and it's at that instance that they will now be found out to have hepatitis. So, and most times it's already a chronic thing. So basically the major thing is just the fact that people don't usually go for checkups, routinely. Aside that, I don't think there's any issues with diagnosing hepatitis. Then for the treatment, I think you mentioned something about the treatment too. So treatments basically, especially for the chronic hepatitis, it has no cure. It can only be managed. So that's why we always advocate for preventive measures. Yeah, we advocate that people, do what is expected of them in order to prevent the infection in the first place. But and for because it's a chronic illness that does not have a cure, you can only manage symptoms and give supportive treatments where needed. And also in some instances, there can be antiviral medications given to patients just so that they can reduce the viral load and reduce the eventual outcome of these diseases, but it doesn't have a cure. Yeah, when it's chronic, it doesn't have a cure.
Okay, in addition to what you've mentioned, what preventive measures and public health strategies would you recommend to reduce the burden of viral hepatitis in Nigeria, particularly in high-risk populations?
Okay, the preventive measures are actually related or likened to the modes of transmission that are available. So one, avoiding risk factors, and the risk factors include one, alcohol intake, because alcohol is responsible for hepatitis. It's not just only the hepatitis virus that can cause hepatitis. So avoiding alcohol intake, and also avoiding means of contact with contaminated blood, because you wouldn't even know someone that is infected. So it's important to take precautions so that you don't get in contact with people with the blood of infected people. And ways by which this can be done is avoiding the sharing of sharp objects. For people that go to barbing salon that share public clippers, people that do many pedicure and manicure, piercings, tattooings, and all of these procedures that require the use of sharp objects, they should be avoided as much as possible. And in cases where they cannot be done away with, you just have to do maybe like in surgical procedures or some other procedures like that. Ensure that these instruments are well sterilized, and the ones that are not reusable should be discarded as soon as they are used for one person. Then another thing is also transfusion with screened blood. Usually the practice is that for every blood that is donated, there's usually screening, pre-donation screening, so that we know if the person has infectious diseases or not. And so every blood that will be transfused should be screened properly before they are transfused into patients. Then also multiple sexual partners, unprotected sex, because hepatitis virus can also be spread through semen, vaginal fluids, and other body fluids. So it's important that we take note of that and avoid multiple sexual partners, unprotected sex, as the case may be. Then another thing is also food hygiene. Remember I said hepatitis A and E are transmitted orally. They are transmitted through contaminated food and water. So it's important that we practice safe and safe food safety and good food hygiene, so that we don't just eat anyhow, eat any food from any source, unverified sources, or undercooked food as well. Then the last one and the most important actually is the vaccination. It's important to know that hepatitis A and B are vaccine preventable, but we have only hepatitis B vaccines readily available to us here. And because hepatitis B is the menace that we actually face with, so hepatitis B vaccines are available to be taken. It's not just available for children, because I'm sure people probably are aware that hepatitis B vaccine is part of what children take as part of their scheduled immunizations. But adults as well can take hepatitis B vaccine. It's usually in 3 doses. When you take the first dose, the second dose will be taken a month after the first dose, and the third dose will be taken 6 months after the first dose. And after these 3 doses, at least you can be sure that you already would be protected against these viruses. And people that, are the high risk populations may have to take booster doses in later years, let's say 10, 15 years and above, just to also optimize their immunization. So that's what I'm going to advocate for everybody. Get tested to know your status. And if you are negative as of today, you can actually, take the hepatitis B vaccine. But if positive, you cannot take hepatitis B vaccine. All you need to do is just to go to the nearest hospital, meet with your healthcare providers so that they can do the routine tests that are important and necessary, and also help you monitor, the state of your liver, go for routine checkups, and avoid the risk factors that have been earlier mentioned. Thank you.
Yes, now, thank you for that. But now, in addition to the measures that you have mentioned, I mean, the measures have been targeted at individuals. What other measures do you think that, or do you believe that public health advocates or agencies and even the government and the like need to employ to mitigate this situation?
All of these that we've mentioned concerning the preventive measures actually on the individual basis. So something else that can be done, or some other things that can be done basically, are stuff by public health advocacies and even input from the government. So awareness like this, like you're doing a good job, bringing this on. Public awareness on hepatitis, it goes a very long way, because we won't be too shocked if you have people that have never heard about this before, and this might be their first time of hearing about hepatitis and how it can be prevented. So awareness, health education, advocacies can be done by individuals, organizations, agencies, and even government parastatals as well. And more outreaches can be done, because the fact is that many people know their status through public medical outreaches that are done, where they can actually do the test free of charge. So more outreaches, more free medical outreaches that would involve people having to know their status, undergoing the rapid testing for hepatitis, will also be a good thing to do, at least where people know their status, and to also be able to know how to go about their health state going forward. Thank you.
Well, thank you for lending your insights on the program, as always, Dr. Adekboju Adejoke. Thank you very much. We'll now go on a short break. 360 Health will be right back. Welcome back. We're still discussing the dangers of viral hepatitis. I'm now being joined by CEO of Living Health International and public health physician, Dr. Gbenga Adebayo. Thank you very much for coming on the program, Doctor. Now, how common is hepatitis B and C in Nigeria, and what are the biggest risk factors? Could you shed light on specific demographics or regions more affected, and the common transmission routes, such as unsafe injections and the likes?
It's really common, right? Up to, we say that about over 8% of Nigerians have viral hepatitis B, and 1%. That's a lot of people. By the time you multiply, that's over 20 million Nigerians living with viral hepatitis B, and over 200,000 have viral hepatitis C. So it's really common. So what are the symptoms? The symptoms of viral hepatitis, we just start with, when you catch it, the acute infection. The acute infection, when you just catch it, and then you have a viral illness, it looks like you have malaria, and then your system, you can clear. Some people will go on and they'll be fine. But for some other people, they will carry it, and it will be there in their liver, destroying their liver. When they have this small illness, they can have some yellowness of the eyes and what have you. But like we said, it's that long-term, that chronicity, that long-term illness. That's what we are really, really, really concerned and worried about. So it's important, again, we can't reiterate it again, let everybody get tested. Let's know what's happening with you. So if you have a diagnosis of viral hepatitis B, there's little, once you have the disease, there's really little that can be done apart from monitoring you And then as your liver needs it, then treatment regimes, management regimes to protect your liver, to keep you going. That's very important. For viral hepatitis C, that's more common amongst people that needle injections. That's what we see it more associated with needle. So we see it with people that people who inject drugs. So we can have that disease. But that doesn't mean that everybody that has hepatitis C that inject drugs. No, just say that it's more common amongst so sexual intercourse, both the viral hepatitis B and C, because it's blood-borne. Any body fluid, sexual intercourse, blood transfusion. But thankfully now, before you receive blood in a lot of our facilities, that blood is screened for viral hepatitis so that we don't use that. So that's part of the safety. That's what is important that needs to be done to prevent transmission of the disease. So everybody should go for screening. That's what I would say. Everybody go for screening, get to know whether you have viral hepatitis or you don't have viral hepatitis. And if you don't, then please get vaccinated. Get vaccinated. And we'll say again, all children should have the bed dose. When we say bed dose, those are women. We are told take your viral hepatitis bed dose vaccination. Then they will come 2 weeks after they have had their baby to come and take the bed dose. It's not really anymore a bed dose. You're meant to take that bed dose within 24 hours of giving birth to your child, and it is free within 24 hours. Get that vaccine. Government has made provision for it. We know there are logistic challenges in getting it across, especially to people that develop in some centers, deliver in some centers or deliver over the weekend. But as you are there, and I think that's one of the things this program can get you to get that information out, that pregnant women need to get their children that vaccine within 24 hours of having their babies. That bed dose is so critical. It can, because by the time some babies are born and they are taken home, by the time they come back in 2 weeks, in 3 weeks to get a vaccine, they're already infected. And the earlier a child gets infected with this disease, the worse the prognosis of getting the end stage that we don't want, which is liver cancer. So please, what can we do? Bed dose, and everybody should go on to get vaccine. Bed dose within 24 hours, not just bed dose, within 24 hours of having their babies. All right, thank you.
Okay, now you've mentioned different ways of transmission, but we need to know if symptoms of this disease do appear, what are the early warning signs that should prompt someone to seek medical help, or is it usually without symptoms?
So the person can just have a mild fever, right, with mild yellowness of the eyes, and that's about it, and then they get like most viral illnesses, and they get better. But that they are better does not mean that they are fine. The disease is there. It's truly destroying the liver and causing challenges in the long term. And some people, they will not know that what happened to them, that they've had viral hepatitis. The first time they will present in the hospital will be with liver cancer. That's why the disease is so that's why we call it the silent killer. The first time that they will present in any hospital with anything that the person has liver cancer, viral hepatitis has destroyed the person's liver. So we reiterate again, right? Vaccination is critical. Vaccination is important. Screening, let's get to know if you have viral hepatitis and then be vaccinated against the disease.
Indeed. Now, what steps can the government and healthcare providers take to improve testing and vaccination? And are there current initiatives like this currently in place?
Part of the challenge with viral hepatitis in Nigeria and even globally is there's limited political will and funding. Right? It's like for a disease as so important, as so that the cost in human lives is so high, there's little funding and there's little discussions about the disease. Yes, every now and then when we have World Viral Hepatitis Day, some things, and then we know that some people have. So we will say that let there be a budget line, right? A budget line for viral hepatitis across all the states. How much money are we willing to spend to prevent mother-to-child transmission, to protect our pregnant women, to screen, and then to ensure that this birth dose for children born within 24 hours is administered. Within 24 hours, every baby born in our nation should have hepatitis B vaccine given within 24 hours of giving birth. And then we can now go ahead to make sure that all our children also now get their routine immunization against viral hepatitis. So if we can invest more money, more resources into promoting awareness, into prevention, and of course, treatment. We just said 200 million Nigerians have this disease. They need to be managed. They need to be treated. And that treatment costs money. We need to find a way to reduce the costs of treatment. Hepatitis C, viral hepatitis C, is curable, but the drugs are expensive. So we need to get those drugs cheaper, make it available for our people so that we can cure and get them on. But education, getting people to know the harmful practices that fuel viral hepatitis transmission. You get people to know it, right? Scarification marks, when people do all kinds of incisions on their body, and some of them do it as part of traditional practices. We are not saying people should stop their traditional practices. But what we are saying is that it should be done of course, if it's harmful, we should stop harmful, right? But if you want to do it in an hygienic way, right? The ones that are not harmful, that's just what you do that you want to do. So do it in an hygienic way. Make sure you observe blood safety protocols so that we don't keep transmitting. There are communities that you have up to 40% of people in that community, 40, 4 out of 10 with viral hepatitis B. That's a crisis. That's a crisis. So we need to step up awareness, prevention, treatment, and that will require resources.
Now, while you've mentioned the need for Nigerians to get tested, even when they get tested, are there, in the case where a person has found that they have this disease, are there effective treatments or cures available? And how accessible are they to the average Nigerian?
Okay, so like I said, viral hepatitis A and E, they are blood, I said that, viral hepatitis A and E are foodborne, right? They are fecal-oral. It is B and C that we are, that have this long-term chronicity, long-term sequelae of events. And viral hepatitis B is not curable. I know there are a lot of claims. People say you take this herb, you take that, and some people spend so much of their meager resources and are preyed upon by charlatans, saying that they have a cure, one cure and the other, and chasing cure. There is no cure for viral hepatitis B. However, there is a cure for viral hepatitis C, medical cure available. However, those drugs that bring about the cure are expensive. They are expensive to procure, and the vast majority of people do not have access to the means to buy these drugs and treat themselves over the cost of the drugs that they need to use it for and be cured. So what we need to do is to get more people aware. Those drugs, but for viral hepatitis B, even though it has no cure, we can be managing it. We can manage. We can protect the liver. There are things that you can do to their medicines, and working with our specialist doctors, our gastroenterologists, where you can find in a lot of our tertiary centers and even some secondary centers, general hospitals. You can have specialists that can treat. And even what we are doing now is to talk about the public health approach. So we don't just want the specialists to treat. The regimes are there. If this is this, do this. If this is this, do this. So treatment is available, right? Management is available. However, in this instance, this is one of the instances where you see that prevention is what is an ounce of prevention is what more than a pound of cure, because there is no cure for viral hepatitis B. There's no cure for it. So what we need to drive on is early detection, right? Prevention, very important. That's the prevention. And vaccination. We vaccinate our children. We vaccinate all of them. So you are here, you are listening to this show. One of the things you can do for your child is, if you know any pregnant women around you, let them have this birth dose within 24 hours. of having their children, and let's ensure that our children receive their full course of hepatitis B vaccines. This will help us to have this scourge under control.
That was quite the insight you gave. Thank you for sharing your thoughts on the program, Dr. Gbenga Adebayo. It was a pleasure having you on this episode. And that's it on the program. Thank you so much for joining us. Until next time, bye for now.